Tell him that we are going live in 2 seconds. Share the link.
Yogi, can you hear me? So we're going live in 2 minutes. Can you hear me,
2
Yogi?
seconds. 2 seconds.
Yes, sorry. Yeah, I can
Yogi,
hear.
you're not. You got this. इसमें login था उसमें क्या? बंद है. You go here.
Yogi,
Share the link.
Yes.
can you hear me?
Yeah, I can hear you. Can you?
We're going live in 2 minutes.
Yeah.
Can you hear me, Yogi?
Hello, I can hear you.
Yes, sorry. Yeah, I can.
Yogi, you're not.
Hello, I can hear you. Can't you hear me? मुझे आ रही है आवाज. Can't you hear me? Hello.
Yes. Yogi, go ahead. We're live.
Okay.
No, go ahead.
Namaste. Hello, and welcome. This is Yogi Sakha from Holistic Care Center, and today we have with us Dr. Saurabh Talekar, and our topic, the subject for today's webinar is going to be about back issues, back pain, and any kind of musculoskeletal related issues if you want to also inquire about. So before we start with our program, I'd like to quickly introduce Dr. Saurabh Talekar to you guys. So Dr. Saurabh Talekar comes from a humble background from Mumbai. He has undergone extensive training in various aspects of orthopedic surgery. He has an extensive research with trauma acquired at the Saratov State Medical University in the Russian Federation. And during his residency, he had vast exposure to the technique of external ring fixators by Professor Gavril Abramovich for deformity correction, limb lengthening, and complex and compound fractures. He has a special interest in knee and hip disorders and has had years of training with organizations like Central Institute of Moscow and CICOT, Belgium. He has found his passion in helping people through the methods of holistic orthopedics by Padma Shri Dr. John Ebenezer, as he is a strong believer of mind, body, soul healing, which makes his approach humane and empathetic. His interests also lie in innovations and new technology, and is undergoing training in robotic surgeries for the knee joint. He tries to educate and be accessible to his patients through his blogs, and his work in orthopodline.com, which is a virtual telemedicine and bone joint clinic. We also had another guest panelist with us, but unfortunately, he's not keeping well. So this discussion will be with Dr. Saurabh, and you guys are free to ask questions. I'll be asking questions related to joint and bone. So let's get started. Welcome, Dr. Saurabh. How are you today?
Thank you very much, Yogi. I'm doing well. Thank you for the introduction. Good evening, everyone. We are very sorry. We had promised that Dr. Pradeep Kumar Singh, spine surgeon, would be here with us. But sadly, he's down with the flu. We hope it is not something serious, but he's doing well, but he's still sick. So he won't be joining us today. Yes, Yogi, can we continue with this session?
Yeah. So let's start with back pain, especially because of the lockdown, where people are mostly at home, and there's not much of movement which is happening, and the sedentary kind of time which they're spending at home is also considerable. But apart from that, we also have some specific questions which in fact are related to osteoarthritis, which we would be starting with. So let me first ask you, if uh, tell us about the knee osteoarthritis. Is there any available treatment options, and what are the treatment protocol for the same?
Thank you very much, Yogi, for the question. For our audience who are watching us first time, these are my education background, and this is my disclosure. So the question, coming down to the question, what is knee arthritis? So today we're going to talk about only knee arthritis. Arthritis can be of various joints. It can be of various types. Today what we're going to talk about is knee osteoarthritis, which is a very common condition in India. And if you see the commonest surgery performed in the world and even in India regarding this for treatment of osteoarthritis is the knee joint replacement, total knee replacement surgeries. So knee joint, what is knee joint osteoarthritis? So you can see the image on the screen. Knee joint is made up of 3 bones. Mainly 2 bones take the whole weight of the body. It is the femur, which is the thigh bone, जिसको हम हिंदी में जांग की हड्डी बोलेंगे, एंड द लेग बोन विच इज द टिबिया, जिसको हम हिंदी में पैर के जो घुटने के नीचे जो हड्डी होती है. Where these 2 bones meet, it is the knee joint. There's also a knee cap, which is the patella, which you can feel at the front of your knee, which is not mentioned in this diagram. Here, if you see the end where these 2 bones meet, it is covered by some white substance. So that white substance is 2 kinds of cartilage. One is articular cartilage or hyaline cartilage. Cartilage is something smooth, something very smooth for the smooth movement of the joint. There's another kind of cartilage which is meniscus, which gives you shock absorption. So what happens in osteoarthritis of the knee is this cartilage gets eroded, damaged due to various reasons. It becomes rough, and the moment of the joint doesn't remain smooth. There's also, in advanced disease, there is bone in bone contact, how you can see on the right side of the image. So there is contact between bone, and the bone rub against each other. And this also causes some kind of deformity of the knee. घुटने टेढ़े हो जाते हैं. And there are these small granules which you can see here. They are called osteophytes, which is loose fragments of bone which are located in the joint in this disease. So this is how it happens when it is advanced level of arthritis. So just for a general understanding, for our audience today, we are not expecting many of doctors. It's mostly patients, laymen, patients' relatives. So I don't want to go into detail, but just to understand, there's a grading system. There's grade 1, 2, 3, and 4. So grade 1 being the mildest, and grade 4 being the most advanced, where there's all these loose bodies and deformity of the knee. Why I talk about grading is because the spectrum of treatment of knee arthritis. So this is what modern medicine, if you go to any orthopedic practitioner, this will be the protocol followed by an orthopedic practitioner for treatment of knee arthritis. So what do you see here? We'll start from the bottom of the pyramid. The bottom of the pyramid, there is non-pharmacological. Non-pharmacological is no medicines, other things what you can do except medicines. Education of the patient to tell them about the disease in detail, diagnosis, exercise, prevention of injuries, weight loss, orthotic devices. These are done in the initial phase. After that comes topical. Topical is what you can apply. So NSAIDs, these are drugs These are preparations which you can apply on the skin, which will give you some kind of relief in your symptoms. Then you go ahead on the third stage, which is drugs, which are you consume them in form of tablets, which are supplements which may prevent inflammation. They're anti-inflammatory. They're also drugs which are non-steroidal anti-inflammatory drugs. These should be only prescribed by doctors, because there are multiple contraindications, which is there are specific patients who cannot be prescribed these drugs, or you need to see what are the current medical conditions so that these drugs are prescribed. Above this, now if you've done all of this and this has not worked, above this comes injections directly inside your knee joint. So this is called, in a scientific language, it's called intra-articular injection. So these injections are of two types. One is a steroid shot, which gives a temporary relief but a quick relief. And another, there is a preparation called hyaluronic acid. So these are two kinds of injections available, which can be directly given inside the knee joint. There are again indications and contraindications. And all of this doesn't work. If all of this doesn't work, then surgery. Surgery also is of different types. Usually, if you see in India, people, the Europeans, the Americans, they usually go to doctors when they have minor issues. They would go to the doctors and address those issues in time. But what I've seen in my OPD and usually also my colleagues, people usually come in very advanced diseases. So they come down to the clinic when they have deformities. So it's usually an advanced disease. So sometimes they're directly offered surgery. So this is a problem we're facing. There are different reasons for this. One is they can be treated for years at a general practitioner. They must be trying out different things. You see these advertisements on TV, all these oils and all what you can apply. There's lack of knowledge among the public. Where can they exactly go for the treatment of these diseases? So sadly, patients directly come in an advanced stage. So in an advanced stage, the treatment for deformed osteoarthritis and all of the compartments of the knee are involved is totally replacement. But if a patient comes in earlier, there are other kinds of surgeries which I don't wish to go in detail in this seminar. So why I have discussed about the modern approach. So this is the modern approach, and where is it lacking? What I feel, and that is why I have a different approach of treatment. So in this approach, when you go to a practitioner, you usually see that there is only attention towards the knee joint. So what my approach towards treatment usually is, Yogi Sakha, you must have seen it in detail when we practice. So firstly, when a patient comes to me, it's always human therapy. I want to get to know the patient well and want to make the patient comfortable, because he's come down in a lot of anxiety. After the patient has been introduced to me, I usually ask them to fill a questionnaire. A questionnaire. Now you see these patients who come down to us, why you do not need to follow that approach, the modern approach. And I think my approach is a more complex and more favorable for the patient, is because when a patient comes to me, the average age of a patient is 55 to 68. And these are the diseases or the problems the patient is facing when he's come to me with knee pain. So like he's got blood pressure, hypertension, he's got diabetes, most of the 50%, more than 50% of the patients in India, heart disease, kidney disease, other bone and joint problems. So maybe he's come down to me for a knee replacement surgery, but he's also got a back pain or other joints which are paining, neck issues. There is stress at this age. There is depression. There's a lot of people who have undergone separation from their families. They have socio-economic issues, dejection. So these are geriatric problems which a patient is facing. And I think in this approach, the modern medicine approach, these problems have not been dealt with. What has been dealt with is the knee, and that is it. The economic problems are always there. So this is my approach. First is human therapy. So why this approach is because we understand that a human is not only mere bones, flesh, skin. We do not just look at the knee of a patient. We think that a human is made up of a different aspects, which is first his body and then also his knowledge, his emotions, the amount of stress he is going under, the amount of happiness he has in life has a vast impact on his life. So that's why this approach, and I'll tell you in detail what my approach is. So I spoke earlier about human therapy. Then there is a questionnaire. So what is a questionnaire? So there is a holistic KYC, know your case, where there is a detailed questionnaire every patient has to fill up, where there are questions about his day-to-day living activities. How much does he pay attention on what he is eating? How much is he sleeping? Is he getting adequate sleep? Is there any stress, anxiety? Does he take out time for activities like exercise, yoga, meditation, or all of that? So we try to find out if there is this mind, body, and soul. All of them are in one line and all of them are well. And if they are unwell, then what is the reason behind it? So that is what the focus of my questionnaire is. Then once you have this whole history of a patient, you also know if he is a diabetic, you also know if he's a heart patient, you also know what all of the conditions in this questionnaire. Then I go to education. I examine my patient thoroughly. That is done by every orthopedic surgeon. After examining my patient thoroughly, I believe in education, because when I educate the patient, when I tell the patient, this is the diagnosis, this is the problem you're facing, and these are the treatment options. I know a lot of practitioners follow this, and a lot of practitioners do not find time to do this. But I find really important the education part, because half of the anxiety of the patient is relieved when he gets educated well. Then I come to judicious drug treatments. Rather than directly going on to heavy painkillers and fixing the problem temporarily, and as I already have adequate information about the diseases he is facing, I follow judicious drugs. When all of this is done and a diagnosis of osteoarthritis is placed, uh, there are options. The three next step are the main base of my treatment. One is, if a patient has come to me with knee pain, and if he's in his late 50s or early 60s or even 70s, not only his knee joint is the affected joint. As age comes over, there are changes in the body which happen. The color of the hair changes, the texture of the skin changes. The same way, all of the joints are getting degenerated, because the hips and the knees are the most weight bearing joint, and the spine. There are symptoms in these joints first. That doesn't mean that all of the other joints are not damaged. So that's why the exercise routine which I start my patients on is a full body exercise routine, which is mind body coordination exercises. uh, After that, when a warm up is done, I start them on physiotherapy. Physiotherapy is therapeutic exercises. It's done under guidance of a physiotherapist. It is done for the part which is sick, as in here, the knees. So it focuses on strengthening the musculature around the knees, above and below. it focuses on increasing of range of movement of the knee. Relaxation therapy. So what does relaxation therapy means? This is a guided meditation program. So when all of this is done, it is very important to alleviate the stress which the patient is going through. So the guided meditation is part of the mind healing. When all of this is done, he's also suggested to see my team member who is a nutritionist or a dietitian, because what we eat is what we are. There are numerous food products which cause inflammation. If you eat a lot of sugar, if you eat a lot of processed products like maida, so these are products which may cause inflammation. There are some diseases which can be just taken care of if the diet is sorted. So these patients do not have adequate education about what foods to eat and what foods to not eat. There are nutritionists who are also well versed in the foods which cause anti-inflammatory effects. So there are some foods which can be encouraged to be eaten by these patients. And reversal therapy. This is very important. What is reversal therapy? So if a patient who is addicted to eating and is overweight, just giving him a pill will not solve his problem. His problem is going to solve by this starting this treatment begins from the mind. His problem needs to be solved on a psychological level. He needs to understand the psychology of eating, the proper method of food and everything, and he needs to reverse it back. So once you reverse the bad things you're putting in, all of these diseases start reversing. For example, a patient who's suffering from bronchitis due to chronic bronchial asthma, all of these lung conditions, and who's a smoker, if you stop this smoking, he is able to reverse these conditions. So by reversing all of these conditions, all of these diseases, they trouble you lesser than what they are troubling you right now. So this is my protocol of treatment, which includes a holistic method, which is not only treating the knee itself and treating the whole human being, not only body, the treatment for body, mind, and soul. And yes, of course, if all of this is not able to suppress the symptoms of the patient, then of course, I'm an orthopedic surgeon. I would like to operate and try to take my patient out of this pain. Why go through all of that? There are a lot of knee replacement surgeons who are offering knee replacement surgery. You go to a knee replacement surgeon. Why do I exercise? Why do I change my diet? Why do I meditate? Why do I go through all that trouble if just some knee surgeon can change the knees and put me new ones? So, why holistic approach is the question, what you might ask. So these are the facts on what I feel why a holistic approach is better before going to surgery, because 20%, and this is a number from GBJS, the references are at the bottom. 20% of the patients who have undergone knee replacement are dissatisfied. So 20%, is it a small number? Is it a big number? I don't want to be the one to be commenting on. But I wouldn't be a happy surgeon if every one patient out of my 5 patients are unhappy. So dissatisfaction rate of this surgery is 20%. When you go through all of this trouble of holistic approach, there is a improved chance of outcome of the surgery. It makes the general condition of the patient well. So if it's a diabetic, his diabetes goes under control. If he's a cardiac patient, his cardiac conditions improve because of the diet, because of the meditation, the stress relief, and all of that. And that is why the surgery becomes safer. This also improves the post-operative rehabilitation. So one more thing, if you directly go for a knee replacement surgery, it's not that simple that you just go through the knife and the second day you just start walking like a robot. It's not. You're not a machine. There is a rehabilitation regime what you need to follow after you have undergone this knee replacement. So the patients who have undergone good holistic approach, all of these exercises, all of these treatment routines before the surgery, they find it really simple to recover in the post-operative phase, and they are back in action as soon as possible. And the biggest point, all of these numbers, all of these references, all of these literatures come from the West. As you know, people in the Western countries, in Europe, in USA, they are a lot active. A 60-year-old person in Europe might be still playing tennis or golf. Uh, our elders are not like that. Our elders just do some kind of house activities. They just go down to the park, they roam, but they're sportively not that active. So a patient who is a 60-year-old or 70-year-old, a European, he's got more demands. So that's why these operations have been developed there, and we are performing them here. But our elderly patients do not demand such kind of sporting activity and all after the surgery. So that's why the numbers which come from the European world cannot be trusted here. So there are a lot of patients who are just comfortable with physiotherapy, with medical treatment, with all of the holistic approach treatment modalities, and they are satisfied to just to do home activities, just to roam out in the park, normal activities. If you're not involved in heavy sport activities, a lot of patients just say, I don't need surgery. And what can be better than avoiding surgery? So this is what I wanted to tell our patients about arthritis. Right now, during the COVID pandemic, during this lockdown, knee replacement surgeries are not being performed. If there is a lot of risk involved, the risk is escalated because of this pandemic. Practically no one is performing knee surgeries at this period. So this is a chance where you have good 3 to 6 months, when even if you might have been proposed a knee replacement surgery, you're not going to undergo one because the risk is too high. So that's why what we have done in our practice is we have converted our physical center is still functional, but we have converted our practice into an online practice. So we have methods to examine the patient online over a video call. We have methods. They get digital prescriptions. They get exercise regimes. They get online support through the consultation. So all of this has been managed by us. And I think if it's knee arthritis or if it is uncomplicated back pain, I don't see a need to go to a hospital, risking it out during this pandemic. And I think you can definitely contact us through our telephone numbers. You can download our app, and we can provide our services even right now. And this is the time, if you've been suggested knee replacement surgery, to start your holistic approach modalities and get fit for the surgery, and you might also have a chance to avoid that surgery. Yes, Yogi.
Wow, that's really some information which I am sure our viewers, audience are going to get benefited from, and especially I would like to also see it in a way where a surgeon um, is not uh, promoting surgery. His main job or his intention here is that his patient doesn't go under the knife. So this is something which is so crucial and important when it comes to today's lifestyle kind of medicine, which needs to be practiced, wherein there should be judicious approach of medications and surgeries as a last resort only. And very few medical practitioners actually believe in this approach. And it's really wonderful. We as a team, as a holistic family, are doing something which I believe is quite revolutionary in terms of the medical field. I would like to ask a question which I had in my mind, and I also believe these people may be having related to the knee arthritis, keeping the conversation around that. So, is there any particular age कि आपको knee arthritis होना है तो आपको उम्र 40-50 साल के ऊपर होनी चाहिए? Is it something age related, or is it something लाइफस्टाइल रिलेटेड जो हम सुधार कर सकते हैं अपने लाइफस्टाइल में?
So it depends. So in my previous slide, I had mentioned the age at which patients come for a knee replacement surgery is 55 to 68, and that is a figure from England. I was not able to find out the specific age in India because the research doesn't exist. I have come across patients. The youngest patient we've performed a knee replacement surgery was 28 years. So this was not due to osteoarthritis. Osteoarthritis was secondary to rheumatoid arthritis. So there are various conditions. Some people might get arthritis due to an injury. This can happen at any age. But when it comes to arthritis due to aging, 55 to 68 is that figure.
Okay. Uh-huh. So we'll move on to our next big question and issue which people actually are facing this lockdown, and that is something which is related to this kind of back pain. So what do you say in terms of the back pain, whether it is chronic or kind of an acute back pain, which people may be getting? I have my neighbor, he is now getting these back pains, and obviously he knows it is mostly because he's been at home for a long time and mostly sitting. But from your medical perspective, what would be the other cause, and what are the main causes of having back pain, especially low back pain?
So I've been facing a lot of patients. I think now we've been providing online consultations to a lot of patients, and there's a lot of patients are scared to go to the hospital. So every 5 patients I see, I think 3 or 4 among them are coming down with back pain, and this has got to do with the lockdown. So if you see, generally back pain can be due to various reasons and of various types. So today's topic, what Dr. Pradeep Singh was going to talk about, is mechanical back pain. We do not want to go into complex and complicated matters. This is the commonest thing, which is mechanical back pain. So I'm talking about mechanical back pain. So which is due to, firstly, why are humans prone to mechanical back pain? Is because of our erect posture. That is the first reason why every person who has born as a human has this posture will get a back pain in some or the other way, is what the modern literature says. What we believe in is we humans are made to be in an erect posture. If you see, in the previous century, we've gone from this erect posture from activities like farming, hunting, running, and all of that. We've gone to a more of a sedentary sitting position. हम लोग एक कुर्सी पे आ गए हैं सब लोग, and that is the main problem with why we are facing this back pain, because when you're standing, your posture is made in such a way that all of the weight goes from your head, your neck, through your spine spine gets divided at your hips, goes through your legs, and that is how your posture is. But when you're sitting at one place, all of this weight, your upper body weight, comes and accumulates at your lower back. And as evolution has made us, I don't think it was thinking of an invention like a chair coming in and we getting so sedentary. So that is the reason why we're facing so much back pain. There are other causes of back pain, which is like lose musculature because of the posture, bad posture. People are usually getting stooped in the front because of all of these devices. So long-term usage of all of these phones, these laptops, what has happened is the musculature in the front has become so shortened, and the musculature at the back is become very flabby, elongated, and weak. A lot of people have a lot of belly fat, so the circumference of their waist has increased, so that is also creating a lot of pressure on the lower back area. uh, with all of this, the diet, or what I was talking about in arthritis, all of these inflammatory diets, that can be one reason, very common reason. And this is a very favorite one because I've undergone a personal experience in this one, because a couple of years ago, as you know, Yogi, I was suffering from middle back ache, and I used to work with the best guys in the industry, and no one could diagnose it. And the reason was related to stress. And when I managed my stress, all of the back pain had gone away, because the lifestyle I lead, I take care of my food, I take care of the workouts, I'm active, my work is not sedentary. I was not able to know what the reason is. And very less doctors think about it, the stress factor. So there's a lot of back pain which is called by stress. There are also terms like fibromyalgia, which are coined for stress backaches.
Yes. In fact, this is also maybe one of the reasons out of the mechanical aspect which you just mentioned. So I think our viewers who have got really a better understanding, if any one of our audiences is going through certain backache challenges related to their lower back. I believe these tips which doctor just mentioned about keeping our spine mobile, to indulge in some kind of physical activity on regular basis, doing some stretching, managing our diet, and in a better way, and also our emotions and stress management plays a very big role. So indeed that needs to be looked into and applied. So doctor, when it comes to this backache aspect, we are still kind of in that topic. Uh, so especially who all are prone to kind of suffer from it. Of course, there are people wherein they can be even because I see right now, maybe not during the lockdown, but even kids who used to kind of when they used to go to school, uh, kids, their posture when they go to school with the heavy bags, even these small children are suffering from posture related issues and lower back problem, upper back problem. So who all are the vulnerable group which comes under this back issues, or is it something which anyone can have at any point of time, because it's now so epidemic almost like?
So, this is a very interesting question. I think the vulnerable group is females, because after a certain age, uh, females have depreciating amount of, like, they face osteoporosis, weakness of bones. So that is a vulnerable group. People who suffer from who have sedentary jobs, who are sitting at one uh, position for a long time, they are a vulnerable group. People who have bad postures, they are a vulnerable group. So lifting habits, those people who do not focus on their back while they're lifting something, those who have bad sleeping postures, they are a vulnerable group. So I think all of us, if there's a patient who comes with a back pain, so back pain is such a problem which makes you kind of handicapped. It makes you very restricted in life. And only after having such kind of a backache, you kind of understand the value of ergonomics. Ergonomics is a science which teaches you how to place a laptop on a table, how should be your head position while you're sitting down, how should be a hand position while you're working on a keyboard, how should be a office design. So you should understand that it is, you go to a doctor with a back pain, you usually get a painkiller, you usually get a muscle relaxant, and that takes care of the problem temporarily. And there's a lot of patients who are going from doctor to doctor because no one has told them the biggest problem for your back pain is your lifestyle. And unless you change your lifestyle, it's not going to go. So your question and the answer of the next question is the vulnerable group. If you're human, you're bound to have a backache. If you have bad habits, you're bound to have a backache.
Yeah. So the entire responsibility comes on our shoulder when it comes to managing our lifestyle, the way we move, the way we eat, the way we think, and conduct ourselves. So, is it also, when we were talking about knee arthritis, is it your experience as a doctor that uh, females, women are more kind of prone to knee related because of their hormonal change which happens? Anything which you have to say, and any particular ways in which they can, address this at a particular age to become more aware and take care of it in a better way?
So even back pain, I do not know the numbers. I'm not very sure, but all of my patients, if I see, more are women. So
Oh.
women are more prone to bone and joint disorders. The biggest reason being, when a woman undergoes menopause, the estrogen levels in the body, they start depreciating, start decreasing. And there are three types of cells in the body which are concerned with bone health. There are osteocytes, osteoclast, and osteoblast. So osteoclast and osteoblast work in an opposite manner. So osteoclasts are cells which destroy bone. So whenever there's a need of calcium in the body for some reason, the osteoclasts get activated, eat up some bone, and provide calcium in your body. And whenever there's excess amount of calcium, and whenever your bones need to get stronger, the osteoblasts engage all of this calcium and form bone. So this process, the osteoclasts always remain active even after menopause, but the osteoblasts, their activity decreases. So that's why whenever a woman comes down to me after menopause, I always try to fix this mechanism. This is definitely not done by something at home, but you need to examine the patient thoroughly. You need to understand her condition, and you need to prescribe certain amount of supplements. You need to prescribe certain amount of drugs to have a good and healthy bone and to prevent osteoporosis. So this is also one fact which women in India are not aware of, and I think they should definitely go to a gynecologist or an orthopedic surgeon who can help them out after they face a menopausal issue.
Yes, really very informative and important information, I believe, especially for all our female women audience out there to see that these kind of changes which happen naturally in the body can be managed and be taken care in advance in a better way, and one did not suffer unnecessarily. That's really kind of good information. So yeah.
What your second next question?
Yeah. Uh, so the next question was related to what you mentioned about the good posture and the way in which there are people who help people, others, or there are people who are trained in helping people how to keep a laptop or how to sit on a chair, like the ergonomics. So can you explain the importance related to this aspect of our body posture, ergonomics, and how this current lifestyle, which has become sedentary, that is something which is
So
driving factor?
I have come back to my treatment approach slide, and this is a holistic treatment approach slide. So the first and the second remains constant for every patient. Third also remains constant, the education of the diagnosis, the education. The fourth one, judicious medications, changes as per the physician, as per the requirement of a patient. So if you see this format of treatment, what I always suggest my patient is one is start exercising after they have pain relief, after my pain relief of the medications what I've given them. I definitely give them medications for pain relief if someone's come down to me with back pain. But after he's got pain relief, and if he's got backache and it's mechanical backache, then he's got a lifestyle issue. So he has got to fix that issue, and he has to start therapeutic exercises. So therapeutic exercises, when you start doing this for the first time, you need to do it under guidance. It is best suggested to be done under a physiotherapeutic guidance. So they treat you exercises which help you strengthen the back muscles, somehow try to strengthen your core muscles as well. And these exercises are focused on fixing your posture. When you go to a physiotherapist, they are the best person who would suggest you on how to improve your posture. They will give you tips on how you can keep reminders and all to keep remembering about having a good posture while you're sitting, while you're standing, while you're walking. So they are the right persons. If there is a person, if there is who is got a lot of posture issues and it is just functional, it can be just treated. There are specialists called occupational therapists. These people are specialists in ergonomics. Ergonomics is what I told you, the science of how furniture is supposed to be designed, keeping in mind the requirement of a human being, keeping in mind a proper posture. And if you have started getting backache, again, you need to fix your stress levels, because no one, I think there are very less practitioners who would tell you about the stress connection with your backache. So what we suggest is complete body mobilization exercises.
I believe we lost connection with Dr. Saurabh. Uh, so apologies about it. Let me see if we can get him back. Hello, doctor. I can't hear you.
Yes, Yogi, are you able to hear me?
Yeah, I think we there was some poor connection. So are we back again live? Yeah, we are live back. Yeah. Uh,
Really sorry, we were facing some internet connection issues.
yeah. So yeah, we are back live now.
Yes. So I was talking about how this posture and relaxation therapy is important for a patient who's undergoing backache. And after all of this, the diet, you cannot forget about the diet. If you have a huge abdomen, if you have an obesity issue, this will never be treated. Uh, Concerning the reversal therapy, there are a lot of studies where you see there are a lot of smokers who undergo backache. So all of these adverse habits should be excluded from a patient. So that is my approach and my suggestion about when you ask which kind of specialist can you approach. So it is all got to be. I know if you're just facing it for the first time, you might not be facing in such a serious issue. But I see patients all the time who are suffering from years and years of backache, and only they would understand the importance of these treatment protocols.
Yeah, of course. And that's why we are here with these many options and these many specialists. And especially, I have been in this field of health, wellness, fitness for a long time. And I can also tell about how amazing our body is, that its ability to recover from any kind of stress, whether it is a physical stress or even kind of a mental stress. It's amazing because if you are consistent with any kind of practice, if you even have couple of sessions of maybe physiotherapy or a yoga therapy, um, some mobility exercises, within that time period itself, your body starts responding and you feel the benefit effects of it. So that should be the driving factor, I believe, for most people, that yes, it is possible for me to change my physical condition, whatever it may be, and we need not feel as if there is no rescue, there is no solution to it. So this way where we are trying to have so many different services available, it's something which makes it really amazing, a whole package. Uh, so we'll move on to the next question. When it comes to the topic we are talking about, uh, so any kind of signs which you see as far as maybe even when it comes to you talked about the knee arthritis and we talked about the lower back pain. Uh, any kind of signs or symptoms one should be aware of, that now he needs a medical attention? Uh, can you shed some light on it? What is the time when one should really kind of think of going for a medical attention, a medical checkup related to either knee arthritis or back issues?
So what I want to put a little light on is the issue in India is a lot of people are not aware about the availability of specialists. So even when I spoke about osteoarthritis, there's a lot of patients who are going to various practitioners. They're going to osteopaths, get trying, experimenting with these oils, which are been advertised on the television. So I would recommend, even at the first symptom, to seek medical educated help, which is like professional help, and not
Hmm.
to go to any of anything available right next door. you should go to a professional. That is one. If you ask me about the signs to panic, like where you might need immediate attention, and if you're talking about backache, so if you have backache and it is going down your legs, if your back pain is radiating down your legs, if there is numbness in your legs, if there is all this current like situation in your legs, if you're getting cramps in your calf muscles, if there is any loss of sensation or power in your legs, so these are the signs of panicking, and you should immediately go and seek medical help.
Mhm. Okay.
Regarding osteoarthritis, I think the pain, there is nothing which is emergency regarding knee osteoarthritis. No one requires a knee osteoarthritis replacement surgery uh, on an emergency basis, but people usually come with a lot of pain. So pain, whenever you get the slightest of the pain, you should go see your orthopedic surgeon, and they may diagnose you right in time, and they might just capture the disease. They might avoid the progression of the disease before it gets worse, and they might just fix you and avoid a surgery.
So pain can be either either by walking, sitting, standing, lifting, any kind of pain in the knee at any moment, or is there any kind of specific movements only then they should be worried about?
So this is a little of a detailed discussion.
Okay, okay.
I think it's every kind. There's a various knee problems which project in different ways. There are different kinds of pains which happen in different kinds of situations. So I think you would need a physical examination or a consultation with a specialist if you have any kind of pain, and they might diagnose the problem and help you out.
Yeah. Uh, so that's something which again is important, that when we should seek the right medical help, and also what is the time and from whom. Very important to go and consult with the professional. So let's see now if we have doctor, are you ready to take few questions? We have got
Yes, please.
anything which you
Yes.
have other than, or we can directly move on to the questions which our audience has asked.
Can we move on to the questions?
Yeah, sure. So there are so this is a very a simple question, but I believe we did talk about it. But Miss Ashlesha Kamble, she is asking how to control early arthritis. So if you can talk about early arthritis, or she's asking about control or prevention, how would you like to talk around that? Control early arthritis.
I think I have spoken a lot in English, so I will also address this in Hindi, I think. And
हाँ, वो बहुत अच्छा
there's
होगा.
a lot of request from our audience to have Hindi and Marathi talks. So early arthritis, ये अच्छा टाइम होगा जब भी आप जा सकते हैं आपके ऑर्थोपेडिक सर्जन के पास में, जब भी वो आपको इवेल्युएट करके डायग्नोस करे कि ये आर्थराइटिस ही है या फिर और कोई कंडीशन है, और अगर आपके ऑर्थोपेडिक सर्जन ने डायग्नोस किया है अर्ली ऑस्टियोआर्थराइटिस और बाकी सब डिसीजेस रूल आउट कर दिए हैं, तो आप एक्सरसाइज रूटीन चालू कर सकते हैं जो पहले घुटनों पे फोकस करे. आपको होलिस्टिक केयर सेंटर के चैनल पे एक्सरसाइजेस मिलेंगे घुटनों के लिए जो है. बेटर रिकमेंडेशन इज आप अगर फिजियोथेरेपिस्ट के पास जा सकते हैं। फिजियोथेरेपिस्ट आपको थेरेप्यूटिक एक्सरसाइजेस सिखाएंगे फॉर नी जॉइंट, जो आपके जोड़ों को मजबूत बनाएंगे, जोड़ों के आसपास के मांसपेशियों को मजबूत बनाएंगे और जोड़ों का रेंज ऑफ मोमेंट बढ़ाएंगे। मतलब जितना मूव करता है जोड़, उसका मोमेंट स्मूथ हो जाएगा। ये इससे चालू कर सकते हैं। इसको छोड़ के आपको अपने डाइट पे, आपको अपने पूरे बॉडी के एक्सरसाइजेस पे भी ध्यान देना चाहिए। आपको अगर नी आर्थराइटिस अगर चालू हो गया है और अगर नी पेन चालू हो गया है, इसका मतलब है आपको अपने जोड़ों का ख्याल रखना शुरू कर देना चाहिए। दूसरे जोड़ भले ही अगर अभी दर्द नहीं कर रहे, पर हो सकता है वहाँ पे भी इनिशियल लेवल का आर्थराइटिस चालू है। तो इसीलिए टोटल बॉडी वर्कआउट्स आपको चालू करने चाहिए। अगेन मेडिकल गाइडेंस के अंडर। और एक बात पे मैं ध्यान लाना चाहूँगा, जो एक्सरसाइजेस हम जिम में करते हैं, many of them have therapeutic value and they do improve your all around health, but it's usually done by youngsters and it's more over focused on aesthetic wellness. So the exercises I'm talking about is for therapeutic wellness, which is जो जोड़ों के लिए अच्छे हैं वैसे एक्सरसाइजेस, आपके स्पेसिफिक मेडिकल कंडीशन के लिए अच्छे हैं वैसे एक्सरसाइजेस।
ओके, ग्रेट। तो दूसरा क्वेश्चन हम लेंगे कि यहाँ पर पूछना चाहते हैं कि हाउ सेफ आर ये जो इंजेक्शंस रहते हैं, हाउ सेफ आर दिस इंजेक्शंस व्हिच आर गिवन फॉर नी आर्थराइटिस, एंड उसका कोई साइड इफेक्ट होता है क्या?
So knee arthritis, there are two kinds of injections. It's called intra-articular, which is inside your joint, is directly given inside your joint. There are two kinds of injections given. One is hyaluronic acid. These are preparations. There are companies like Johnson and Johnson. They're creating preparations like Synvisc. So these are very expensive injections. What they claim to do is improve the amount of cartilage and somehow create an anti-inflammatory effect in the joint and improve the fluid inside the joint is what they claim. I have seen effects, some patients doing really well after such kind of injections. There are also patients, like 10-15% of patients do not get any positive effects after these injections. The good part about these injections is the hyaluronic acid injection, they do not have any side effect, except maybe very rare cases that you might get allergic reactions or something like that. But there are no side effects to these injections. But the biggest point where you are thinking whether to give this injection or not, these are really expensive. They might cost you some anywhere around 18,000 to 25,000 rupees, and these things are not covered in insurance because it's done as a outpatient procedure. It's done in your clinic. So that is one type of injections. And I usually, there are various kind of practitioners doing these injections, but I usually prefer doing them in patients who are young, in patients who have initial stage of maybe first, second stage of arthritis. So those are some conditions what I consider. Then second type of injections are steroid injections. So steroid injections are given same intra-articular. They are not as expensive as the hyaluronic acid injections. Steroid injections are a quick fix. Quick fix is suppose a patient who's come down to me and he's not able to undergo, he's planned for a knee replacement surgery and he's not able to bear the pain at this moment and he just wants to delay it. He just wants to delay the surgery by 1 or 2 months. then I would just inform that patient that I'm giving him a steroid shot, and this is just going to give him a temporary relief, and go ahead with the steroid injection. So there is this specific thing. And if a patient is in severe unbearable pain because of arthritis, we can do a steroid shot. Those are two conditions where I use these steroids. Where we do not use, or where we try to avoid these, is diabetics, because the sugars tend to go out of control when you give a steroid shot. Now, if you see any layman or any person, they will talk about complications related to steroids, and you can hear them all of the time. There are a lot of side effects of steroids. And yes, there are a lot of side effects of steroids when given in a tablet form, when given intravenously, where it acts systemically. When it is given in a intra-articular manner, which is inside your joint, uh, of course, it gets distributed into your system, but the systemic effects of the steroid is very minimum. So it mainly affects inside and around the joint area. So there are complications, but they are limited, and they should be definitely considered, and they should be like well planned, and the patient should be thoroughly examined, evaluated, and thought about. The patient should be explained about all of the complications, and then only you should go for a steroid injection. That is what I think.
Great. So there's one more question. In fact, there are quite few. This one is about: is there any relation of thyroid issue with your joint or knee pain, or bone and joint? If someone is suffering from any thyroid related disorder, can they also have any bone joint related issue?
So,
Anything?
hormones, thyroid issues, yes, definitely. There is very much relation in the quality of bone. Uh, Hypothyroids or even hyperthyroids are seen to have bad quality of bone. So, yes, this definitely comes in a part of your treatment. If you have a bone and joint issue and you go to your orthopedic surgeon, they will definitely want you to see a specialist. And if you have a thyroid issue, they would definitely want you to see a specialist who will take care of the thyroid issue, because this will definitely affect on the bone and joint health.
So I believe one can get the thyroid levels and vitamin D checked up and see if there's any kind of hormonal imbalance. Um,
I think so there are various methods of dealing with this. There's a lot of people who are very keen about, very much enthusiastic about their health, and they undergo all of these screening tests yearly. So if there is any problem in these screening tests, they can definitely address those. And if they have any kind of symptom, visiting your orthopedic surgeon or visiting any of the physicians who are available, they can specifically target on your symptom and prescribe tests which you're supposed to be performed, and your condition can get diagnosed better.
yeah. So this question is very interesting, and in fact, this is something which I believe you also have an experience about how to balance mind and body when it comes to pain, by Dr. Aruna Deshpande. And I would like to tell our audience that we are going to have, I will take this time to, just because we are talking about pain aspect and management through holistic aspect. We're going to have a series of meditation on Monday onwards, 1st June to 5 June, 5 days of meditation with yogi. So with me, you can always check and inquire with our staff to know more details about it, where I would be taking you through certain powerful meditations for healing, empowerment, and abundance aspect on all level. So as far as the question is concerned about balance, mind and body when managing pain, uh, from your personal example, what you would say, how, uh, what is that which you can say related to this aspect of mind and body, and how did you overcome? Any tips which you can give?
So pain is a symptom which is evaluated and analyzed in your mind. So if any of your organ is paining, the symptom is coming in through your mind. So that is the approach. If this specific question is related to stress-related pain, and I think pain when a person is going through any kind of a psychological issue or a psychiatric issue or depression, anxiety, all of this. I really do not. I try to diagnose all of this. It is a team approach. There are specialists like Yogi Sakha, who's a happiness coach, who helps patients in dealing with all of these conditions. There's also Dr. Chinmay Kulkarni, who you can contact on it. So I would definitely want you, if you're facing any issues, I would definitely want you to get in contact with our specialist, and we can help you out with this. Yogi, I'd also like you to comment on this specific question.
Yeah, so doc, she has not mentioned any specific kind of pain in back pain or any other part, but I see that what you mentioned, every pain is experienced and we perceive and we get it, uh, through our the nervous system, which carries the pain signal and is experienced in the mind, in the brain. And when we are already having certain kind of pain, which is kind of an inflammation related to uh, stress of emotions, or inflammation which is already there in the body because of physical lack of physical exercise, or lack of sleep, or lack of when it comes to nutrient and nutrient dense food, we may be over eating certain food which are highly inflammatory. So that builds up overall pain, intolerance. We become intolerant to pain, and we can become quite sensitive even to a small pain which may be in our body, but now being experienced in a very greater intensity, because there are so many stressors which we are dealing and which we are carrying because of the lifestyle, poor lifestyle. So what I would suggest, again, what we do over here in terms of teamwork, in terms of holistic approach, manage your diet, use certain kind of practices of mind management, emotional management, meditation, breathing, awareness, visualization. तो आप जब ऐसे करते हो कि आप आपके जो पेन है, आपको दर्द हो रहा है शरीर में, तो जो बाकी के दर्द हो सकते हैं रिलेटेड टू आपके मानसिक लेवल पे हो, आपकी नींद चाहे ठीक तरीके से आपको नहीं मिलती हो, तो वो आपकी नींद पर थोड़ा ध्यान दीजिए। नींद बहुत ही महत्वपूर्ण है। जब आपके बॉडी को हील करना पड़ता है, आपकी बॉडी को रिपेयर करना पड़ता है, तो आपकी जो नींद है वो अच्छी होनी चाहिए। तो आपकी नींद पर ध्यान दीजिए, और खाने के हिसाब से जो हो सकता है, फ्रेश फ्रूट्स एंड वेजिटेबल्स आप ज़्यादा से ज़्यादा इंक्लूड कीजिए, और जो चीज़ें निकालनी है बाहर, जो रिफाइंड फ्लावर, शुगर, मैदा एंड ऑयल, उनको बाहर निकालिए। तो इन चीज़ों से आपका जो पेन है फिजिकल, उसमें भी काफ़ी आपको सुधार नज़र आ सकता है। So that is something I can suggest, and let's see if we have a few more questions.
I think we are running out of time, so we'll take a last question, and we'll call it a day.
Yeah, so his question would be from someone is asking, is giddiness or imbalance related to back pain? If one feels giddiness or kind of imbalance, or is it something kind of brain related?
So this is very difficult to answer over this kind of a medium. Specific person should go and get themselves evaluated, or at least have a video consultation with a medical practitioner. Yes, there are some kind of neck pains and upper back pains which might cause giddiness and all of these feelings, but they should also rule out other conditions like vertigo, diabetes, and there are various things which can cause these symptoms.
Okay, great. I believe that would be it for today. And thank you very much, Dr. Saurabh, and thank you everybody who joined us on today's webinar. We will come back again next weekend, and we'll keep you updated what we are going to talk around in a holistic, what's happening in our holistic center and what we are going to address. So thank you everybody. Enjoy. Thank you.
Thank you very much. We are available on Android and Apple devices on app. So you can consult with us over the app. You can also call us or send us a mail and get in contact with us. We are physically available at Vidya Vihar, Mumbai. Have a good day. Have a healthy living. Thank you. Namaste.
Thank you.